It's one of our biggest cancer killers.
It is a devastating disease to have.
If I had known then what I know now, there's no way I would have come home.
A game-changing drug is standard treatment across the Tasman. But not here.
We shouldn't have to be leaving our homes and going to a completely different country for us to stay alive.
Do you think blood cancer patients are dying unnecessarily because...
Oh, I don't think that. I know that. Everyone knows that.
Tawhai Reti's husband, Tawhai, started shearing when he was a teenager.
There are still shearers and farmers now that talk about his shearing and want to be taught by him or want to learn from him.
Your hand's starting to cramp up.
The job required strength and stamina, and Tawhai was young and fit. But in 2019, he suddenly collapsed on the job.
So he had a week off after that, and then the following week he went back and he collapsed on the board again.
Months of tests followed. Then, the worst possible news.
He was 29 the day that they told us that he had blood cancer.
29.
29. It was soul-crushing. I had lost my mum to cancer when I was quite young. That brought back a lot of emotions from losing my mum. You automatically go to, he's going to die.
Tawhai was diagnosed with the blood cancer myeloma. It's incurable, but treatable. Tawhai had extensive chemotherapy and a stem cell transplant.
He was on management medication, not very often, and regular blood tests once every 3 months, which was then dropped to once every 6 months because he had gone into remission. His body had recovered and he was virtually back to normal.
He was back shearing?
Yeah, he was back shearing. He was back doing what he loved.
Whoa!
Our kids were growing nicely.
Tawhai and Lani have 4 tamariki.
Charlie's excited.
Here we go.
With a new lease on life, Tawhai accepted a shearing job in Melbourne and the family crossed the Tasman.
And we were really looking forward to the future.
Life was good. But after 2 years in Australia, Tawhai relapsed.
It all changed again. Just one day, same thing. He collapsed on the shearing board. My heart just absolutely sank. And I thought, oh no, here we go again.
So they came back home to be with extended whānau.
We were told just before Christmas Day that he was not going to be alive for much longer. He was dying. There was no options left in New Zealand. He was just slowly getting worse and worse. I was just watching the person I loved more than anything slowly deteriorate and become less and less of himself. I was preparing myself to bury him and to raise my children alone. There was no hope. My husband was going to die.
Myeloma is a blood cancer, a single cell that has mutated a number of times and it overwhelms our system.
Dr. Matt Wheeler is a physician and haematologist.
It can do a variety of different things, invade your bones, affect your kidneys, nerve damage. It presents in a wide range of different presentations that can make it very difficult to diagnose.
And like Tawhai Reti, it can strike people in the prime of their lives.
Is it good?
I've had some really young Māori people diagnosed with often severe end-stage damage that isn't necessarily able to be corrected.
twice as many Māori under 60 are diagnosed with myeloma.
All blood cancers, we see that Māori in Pacifica have poorer outcomes and have a higher mortality associated with it.
We have higher chances of getting myeloma. We get it younger, we die faster. I feel like the severity of it isn't recognised.
There is a drug that could have helped Tawhai, but it costs hundreds of thousands of dollars a year here. In Australia, it's only $40 a week.
It really crushes you to think that money is the thing that stands in the way of saving someone's life.
Life for Tawhai Reti and her whānau is tough without her husband.
There are days that feel so overwhelming, unbearable at points.
Hello.
Hello. How are you?
Tired.
Oh, I miss you. Smiley.
Yeah, his fault too.
Tawhai Reti has been in hospital since January, not in Aotearoa, but in Sydney. His 2 years sharing in Australia qualified him for Medicare cover here and treatment not available to him at home. Fresh hope for the 36-year-old.
He was a dying man when he came, and he could have easily died.
Last December, your whānau were planning your tangi. How does it feel to be where you are today?
Pretty hopeful. Pretty glad I'm here, to tell you the truth. But then I'm not, you know.
Why not?
I just miss the kids. It's all missing home, yeah.
It's likely he'll be in Australia for a year.
It's incredibly tough for him to be away from our children. I notice a decline in his all-over health. He needs us.
Lani has had to leave her job, her home in Greymouth, and her children to be with him in Sydney.
Breaking up the family, it's pretty hard. And having to go to another country to get treatment and not being able to have your family with you, I wouldn't wish it upon anyone.
It's a ripple effect. Tawhai's sister, Crystal, has had to move across the South Island to be there for their kids.
Dealing with his pain, dealing with the demands of bringing up and providing for and nurturing 4 children, I just think they're amazing. The 2 of them have been amazing role models, yeah.
Once a week, Tawhai receives the drug daratumumab, or Dara, for treating his blood cancer.
There he is! Hello! Oh, you're looking a bit better than you were this morning.
Professor Judith Trotman is a Kiwi doctor who now works in Australia. Today, she has some news to share.
And so we gave you the DT pace, and that's wiped out the myeloma cells. Nearly wiped you out, but you are stronger. And you came back.
The daratumumab is doing its job, bringing down his myeloma cell count. In myeloma patients, white blood cells multiply uncontrollably, producing abnormal proteins that can damage bones, kidneys, and the immune system.
What he's been getting is daratumumab added to the chemotherapy.
Daratumumab acts like a guided missile, helping the immune system find and destroy cancer cells.
I said to Tawhai and Lani, I have not uprooted you from your family, from your 4 children, to come to a different country just to try and buy another month or 2 of survival. I see the daratumumab as a step to trying to gain a meaningful long-term remission of his myeloma.
But he's been starting to eat properly again today.
Oh, good.
It's transformed survival outcomes for blood cancer patients for the past 10 years. But in Aotearoa, the drug is not government funded, so comes with an eye-watering price tag.
I nearly fell off my chair. I thought, you're kidding. When they said, you know, you'd have to pay for it, I assumed maybe $10,000 a year or something like that.
Yeah, how much?
Between $220,000 to $240,000 per year.
Across the Tasman, it is available for as little as $40 a week, and Australians with myeloma live at least 15 months longer than those in New Zealand.
The haematologists are not being given the tools of their trade. It's really tough.
Is it sore?
How much was that jab?
Yeah, goodness.
Daratumumab is considered standard treatment overseas and is also funded in almost 50 other countries.
Daratumumab is incorporated in first-line treatments across most of the OECD. New Zealand invests 0.4% of its GDP on medicines compared to the OECD average of 1.4%. And that's where patients with blood cancers, not just patients with myeloma, are exquisitely affected.
The government have recently spent a record $604 million into the drug funding agency, Pharmac. What more could they do?
604 million, that sounds like a lot of money, but when you divvy up across the need, how much of that is going towards treatments for blood cancer?
Before becoming Prime Minister, Christopher Luxon promised to do better for Kiwi cancer sufferers.
National wants these New Zealanders to stay in New Zealand and to fight their cancer with the full support of a world-class health system.
There was a pre-election promise there was going to be this uplift of funding for cancer medicines, and there was very little, tiny little dribs and drabs for a few, rather than really important foundational medicines for people with the second most common blood cancer in New Zealand.
How was your athletics today?
Good, but I got injured.
You got injured?
Well, I just fell.
Oh.
It's not just a health issue, it's an economic issue. The impact on Māori and Pacifica, because it impacts them so much more often and it impacts them at such a younger age, that has a greater economic impact.
We're going to say hi to Dad.
Hi, Dad.
Hey, boy.
Tawhai had been diagnosed at the age of 29, now being 36. That's in his prime productive years. And because of the inadequate treatment of his myeloma, he was not working.
Talk to you soon. Okay.
Love you.
Love you.
Love you, Mum. Love you, Dad.
Love you, mate.
Later, man.
See yous.
We're trying to not just save lives, we're trying to get better lives and productive lives.
Was Tawhai a good candidate for Dara?
Oh, absolutely.
Ticked all the boxes.
It would have been a lot better 6 years ago.
When Tawhai and you made the decision to return back to Greymouth, back home, back to Aotearoa, do you ever regret that?
More than you can know. He could have received this treatment a lot earlier. He could be in remission at this point.
It's an absolute fact that New Zealand lives are being lost so much earlier to myeloma and to other blood cancers.
How grateful are you to Professor Trotman?
Yeah. What do you do to thank somebody that's given your children back their father? I owe my husband's life to Judith Trotman and the rest of her fantastic team.
You're a hero to them.
I just feel privileged to be a part of the journey, and I just hope we can see the journey to the right conclusion. We'll see how we go. Yeah.
I know for a fact if we didn't come here, my husband would not be here. So as hard as it is, I couldn't be more grateful for this opportunity.
We're very, very passionate about trying to create change. I know that we're not the only family going through this sort of thing.
We know it's not been fair for a long time. I'm more interested in knowing what the government, what Pharmac, what the company who make daratumumab are going to bring to the table, because something's got to change.
So we've come to Parliament to meet the man who could make that change, Minister of Health, Simeon Brown.
Blood cancer is one of the most significant cancers facing thousands of patients every single year in New Zealand. I've worked incredibly hard with the blood cancer community, listening to their concerns, hearing what they have to say.
The government says it will invest $27 million into stem cell transplants, but as yet there's no commitment to fund daratumumab.
We've put more funding in around treatment, particularly around stem cell transplants, which is a critical service which needs to be addressed.
Do you know a drug called daratumumab?
Yes, I'm aware of that drug.
It's been on Pharmac's high priority list for 5 years now.
The funding uplift to Pharmac has been significant. I acknowledge that there's more work to do. There's a number of things that we're doing. We need to make sure that that makes the best improvements for our patients. We inherited a system which doesn't even have currently a national wait list. We are fixing that. We're putting that in place.
But do you agree that effective modern medicines reduce the pressure on the health system overall?
Well, medicines is a key part of that. That's why we've improved funding for Pharmac. Part of the funding uplift that we provided in Budget 24 has improved the number of cancer medicines that are available. There's still more work to do.
Do you think that blood cancer patients aren't being properly served at the moment?
I acknowledge that the medicines that have been funded are for only a small group of blood cancer patients. Minister Seaman and I have made our expectations very clear to Pharmac about how we expect them to find efficiencies, work with patient advocacy groups like Blood Cancer New Zealand, free up resource to be able to get new medicines into the hands of New Zealanders.
Pharmac says they want to get daratumumab into Kiwi blood cancer patients' hands, but they don't have the money from you.
And our expectation is that they need to be focused on how they look at how do they find efficiencies so they can continue to invest in new medicines. We've seen them do that.
Do you know why Māori are diagnosed later and have lower survival rates than non-Māori?
Well, I think there's a real focus. Our system needs to treat all New Zealanders based on need.
No, but do you know why there's a huge disparity, Minister?
Well, there is an issue in regards to making sure our health system is treating all New Zealanders based on their needs.
Is it fair that Australians living with myeloma live at least 15 months longer than their Kiwi counterparts?
Look, I want to see improvements for New Zealanders. That's my focus.
So there's no specific lens that you're using for a
Well, regardless of whether someone is Māori,
myeloma.
Pacifica, European, Asian, all New Zealanders should be treated based on the needs.
Half of those living with blood cancer access some form of benefit support. Shouldn't they be out working, living productive, full lives?
And that's why all of these investments that we're doing are about improving outcomes for those patients.
So your message is to wait?
No, my message is we're working incredibly hard. There's a lot to do.
The government is setting up a new oversight group.
The Blood Cancer Oversight Group is all about making sure that the resources we're putting in deliver better outcomes for our patients.
One of the aims in your oversight group is that no lives are needlessly lost to blood cancer by 2035. What do you say to those battling blood cancer in 2026?
Well, there's a lot of work that needs to be done.
Is the oversight group up and running now?
It's currently being established, terms of reference is being finalised.
So this year?
Yes.
How much did it cost to set up?
Well, I'm not sure exact, but the point is it's about current people working within Health New Zealand, current clinicians, making sure we've got a coordinated approach. The investment's going into additional staff. The message to the community is there's significant work underway to improve outcomes for blood cancer patients in New Zealand.
That's a fantastic first step forward. And we from overseas will be watching and expecting the New Zealand health system to lift the outcomes for patients with blood cancer.
Back in Australia, there's been a massive development in Tawhai's treatment.
Probably one of the most exciting days of our life. We were told that Tawhai had been accepted to receive CAR-T. Even 6 months ago, this just seemed like an impossible dream.
That needle takes it out.
He's currently undergoing CAR T cell therapy, where his own immune cells are genetically altered in a lab to better recognise and attack cancer cells.
Yeah, and then, oh look, there's your plasma then.
Without the daratumumab drug, Tawhai couldn't have undergone this groundbreaking treatment.
CAR T cell therapy is a great new therapy. It doesn't cure everyone. It won't be easy, but if anyone can do it, he can.